Welcome to the Power Hour, the industry's biggest and longest running show. I'm your host, Eugene Shatsman, and Vision Expo is coming up next week. Well, I guess depending on when you're listening to this episode, you might be en route to Vision Expo, or it may have already happened. Either way, I promise you're going to get tremendous value from today's conversation. So today I brought back two very important people from the Vision Council, CEO Ashley Mills and Elise Hinkle, the Vice President of Insights and Research at the Vision Council. And we talk a lot about data and the data that they have. Just to give you some context, they're surveying doctors, they're surveying their patients, they're looking at manufacturing shipment volumes, and they're also looking at how often your patients are swiping their credit cards and opticals and how much they're spending. So we have a very informed conversation about data in this episode. For example, are ODs feeling up or down about the year so far in 2024? What does the transaction data show about the same thing? You might be really surprised to hear what they have to say early in the episode before we start to theorize. We also talk about recent studies on consumer insights. For example, are patients willing to pay more for glasses made in the US? And how much more? Or what percentage of consumers use safety eyewear for work or lifestyle? By the way, much higher percentage than I expected. And the percentage of patients who get safety eyewear from their eye doctor is a lot lower than I expected. Of course, we also talk about Vision Expo in the context of what's happening on the floor. Like, what are you going to see that you haven't seen before? Also, where is this industry going? What are the trends to look at? So whether you're at the show or not, you'll know where the conversation in the industry is headed. Anyway, I think you'll find plenty of interesting nuggets in this episode. I want to invite you to subscribe on whatever platform you're using to listen to or watch this episode. I want to invite you to share this episode with others in your network. And I also want to invite you to reach out. One of my favorite things is hearing from our listeners, to hear their ideas, understand the impact that we're making on their business, and certainly get ideas for future discussions. You can reach me on the Power Hour website or go to eugeneshatsman.com. Now, let's go to today's guests. All right, welcome to the Power Hour with Elise Hinkle and Ashley Mills. I think probably the easiest place to start this episode, it's a week before Vision Expo, but also the Vision Council does so much more than just Vision Expo. So while we're definitely going to talk about Vision Expo in this episode, I think, Ashley, the question's for you. Maybe talk more about what the Vision Council does in general.
Well, thank you. I'd love to. The Vision Council exists to promote growth for the entire optical community. So that means the industry and the profession alike. And we do that by virtue of having the expos. The work that we focus on, our strategic key pillars, which you'll hear a lot about, one of them today is research and data. We also do quite a bit of work in government relations and regulatory affairs. We're very active in consumer awareness around vision health and vision care products. And then we hold industry forums and provide professional education. We're a membership organization, so we exist to serve our members and help them grow. But by virtue of having the expos, we're able to do all of this great work, including the work Elise will speak to today.
Well, and it's also pretty impressive, I think, how much data, and you're maybe just a tinge underselling it, Ashley, is that, how much data you all work to gather. When you think about data, some people put out a survey once a year and call that data, and I don't think that there's anything wrong with that. It's just that you do so much more than that. So just, from your vantage point, then we're going to turn it over to Elise. Just what kinds of data are you all gathering and how are you using it at the big picture?
At this point, I can say we're almost to the point where we're gathering all available data. We want to be the absolute first choice for anyone looking for information on the optical marketplace. And that goes all the way down to consumer purchasing data, to our manufacturers' shipments data and analysis, as well as forecasting. And Elise and her team, they know everything from how many doors there are in the US to what a consumer hears when they hear the term low vision. So quantitative, qualitative, and everything in between. We're also incredibly agile. So when asked for custom work, it's something that is met with an eager response from our team, and we get right on it. So we really, it's much, you're right, it is not just the word data, it's everything that can help my members, the manufacturing side of the equation, as well as the retail side of the equation, understand what the patient is doing, what they want, and what they need.
Yeah, so it sounds like you have data that is gathered from every single time that a patient swipes a credit card. You have data from the point of, when manufacturers are shipping stuff and when things hit the docks or when things hit the hit UPS boxes, I guess. And then you also have data where you survey people, right? You ask people questions, whether those are patients and consumers, or you ask the doctors questions. And I think that data all together paints it really puts you in a position where you guys know a lot about the industry and where the industry is going. So I'm going to now turn over to you, Elise, and you oversee research and insights at the Vision Council, right?
That's right.
And
Yep.
I'm excited to hear really what the insights are saying about the last 6 months. How is the industry doing? What are you hearing? And since the two of you have been on the show, a lot has changed. And so talk a little bit about what you're finding.
Yeah, great. Thanks for the opportunity. So we do have a lot of data, like you just talked about, from all different sources. There's a couple things I want to highlight, like for your audience, around sort of the state of the industry right now. So we've just published in the last few weeks a report from providers, so from eye care providers, so it's folks who work in eye care practices. Many of them are optometrists, but some are also opticians or other folks who sort of like a practice manager who work in the practice. And we asked them, we have a tracker survey that we've done for the last couple of years. This year we've shifted to just doing it twice a year instead of 4 times a year. But what we saw in the first 6 months of 2024 is that eye care providers are reporting sort of a marked reduction in revenue performance. So we see that compared to sort of the average in 2023 of people reporting their revenue for the year, we saw an average about 50% of providers said that their revenue in 2023 was above average or excellent, whereas this year, what we've seen in the first half of the year is only 30% of providers saying that their revenue is currently above average or excellent. So 20 percentage points is a big drop in perception about revenue. And so that's something we're still kind of trying to puzzle out about what's happening in the providers that we're surveying. So this was 235 providers that we talked to about their performance. We're also seeing sort of that performance trend across the board, where 2023 is higher than what they're reporting in the first half of 2024. That's true across patient retention, retaining staff, and new patient acquisition. So overall, it looks like that providers are saying, like, 2024, they're struggling a little bit more compared to last year. Now, we also, like you talked about, have a ton of data about sort of what the market is doing overall. So we have transaction data, so anonymized patient data about what's going on in a practice. For that, we have somewhere, I think it's now somewhere over 60 million records of patient transaction data that we're looking at, as well as, like you talked about, sort of card data. So how much people are spending on a credit card at a sample of practice locations. And from there, the data is telling us, compared to 2023, we're seeing it largely flat. So we're certainly not seeing anywhere near 20 percentage point decrease in revenue from year over year. And our transaction data that we're seeing, that anonymized patient data, is mostly coming from independent eye care practices, similar to the population that we're surveying in that provider insight survey. So we're seeing sort of two different forces happening here, where the providers are telling us that things aren't looking as rosy as they were last year, whereas the sort of the hard data is telling us, well, it actually looks like revenue is largely static, staying the same. So it could be that, we're just getting an interesting mix of providers in this survey, or that people are perhaps maybe feeling a little bit more pessimistic than what their actual data is showing.
Well, so let's break that down for a second. So just to summarize, providers are saying, hey, things aren't looking as good as they were last year. And the question was specifically, your revenue is above average or your revenue growth, or your revenue specifically?
Just revenue,
Okay.
not revenue growth. If their
Okay.
revenue is so that yeah, that those percentages were relating to whether the percent above average or excellent.
Got it. So my revenue is excellent or above average, and that group dropped by 20%. And at the same time, you're looking at credit card transactions inside of doctors' offices, and we're seeing that that number is flat. So there's a couple possible explanations that I'm thinking about. One of them being, well, maybe I expect it to grow. And maybe for most doctors, growth is what they consider to be, average, and stagnation is below average, or maybe that's average. But above average for them is I did better than I did last year, and it sounds like maybe I didn't. Or the alternative is that they're just being squeezed, and so maybe they're not really looking at revenue when they're saying that. They're looking at the money left over in the bank account, which would be profit, right? And so maybe my costs have gone up. Maybe my patient is, maybe it's more expensive to operate my practice, whether it's staffing costs, whether it's the cost of goods, whatever that looks like. Maybe it's rent went up, but I have less money left over after this, even if I didn't grow. So maybe it's a combination of those two things. Do you have any other data that supports that, or doesn't, please?
Yeah, so I totally agree. I think that perhaps that it could be that people are, whereas largely static or flat, could be perceived by folks as average. And so they're not reporting revenue as above average or excellent because it's largely flat. I think that's likely one of the reasons here. And as far as costs going up, we do survey those same providers about how inflation has affected their practice. And we're seeing that about three-quarters of providers report that inflation has a direct impact on their operations. One of the most significant ways that it's affecting their practice is through the increase in wholesale prices for eyewear products. And so then we're also, but on the other hand, we're seeing both this in the market and our consumer survey data as well too, that consumers are being a little bit more price sensitive when purchasing eyewear. That this was a trend that started last year and is continuing into this year, where they're opting for sort of more affordable options when purchasing eyewear, frames in particular. So I think that that could be one of the things that sort of is affecting the perception of providers in this survey.
But are you saying they're spending the same amount if your credit card data hasn't shifted, or are you saying that I have to see more patients in order to get the same amount of money?
Yeah, so typically we're seeing that the frame and lens sales, the overall sales are remaining largely flat, so that people are likely seeing more patients than they were before.
Meaning
Um,
in aggregate, it's not per
mhm.
transaction. Revenue per patient is not what you're measuring. You're measuring total money spent on frames, total money spent on lenses.
Yeah, that's what we're looking at when we're talking about the market data, is
Mm.
that instead of like, we're not looking at it sort of per practice or per patient, we're looking at overall spending in the US around frames and lenses. It's remained pretty much the same in terms of the number of pairs that people are buying. But the revenue overall is decreasing a little bit. We saw that in our frames data last year. So
Hmm.
the people are opting, they're moving down from that like 200 plus category. We're seeing like a pretty marked shift in our survey data where people are moving from that higher level of category down to less than 100 spent out of pocket on frames. So
So
that's
that's
where we're
really
seeing a trend.
so that's really interesting. So it sounds to me like it makes sense why practices are a little bit more pessimistic, right? Because they have to see more patients to achieve the same amount of revenue. Otherwise, and so they're looking at some of those core metrics like revenue per patient, and that could be a driver that says it's going down. And it also sounds like inflation, to your point, it sounds like people are saying, hey, my cost of goods are up, but my revenue isn't. And that's a real problem for the practice. So if you're listening and that's your practice, you're not alone, right? That's kind of the situation for the industry. The good news is, though, is that total spend across the patient base hasn't really decreased, right? We aren't like other industries where we took a giant hit. It's just that it seems like consumers are shifting their preferences towards slightly more affordable products. So Ashley, back to you. Tell me about how that impacts what you're going to be exhibiting at Vision Expo, or what you're going to be seeing, what you're going to be seeing manufacturers doing at Vision Expo in response to this.
At Vision Expo and beyond, the Vision Council has been working for several years on specifically supply chain and cost of goods as a result of the China 301 tariffs that remarkably were launched by the Trump administration and somehow consistently upheld and leaned into by the Biden administration. It's something that we are watching. We are trying to figure out what to expect from whatever administration we have in January, but this is not insignificant. So it's, in the early days, it certainly punished manufacturers, but there is absolutely no question that it's hurting practices and it's influencing the patient's decision. So between the cost of goods from the tariffs and overall inflationary pressure, it's a tough market. And then the burden is now it's been passed on now to the patient. So we continue to work on Capitol Hill to get some relief there, and we'll continue to talk about that at Vision Expo with our members. We have an eye on how we need to continue to diversify the supply chain. So we will be doing a pretty big meeting on that at Vision Expo. But one of the strengths of Expo, to your question specifically, like what will people see at Vision Expo related to cost, is it's a diversity of product. You have everything at Expo from the highest end brands to more popularly priced product. You have independent eyewear designers still coming out and showing for the first time with new lines, as well as companies that are really keenly interested in making sure that their price point is right for your practice. So it's an excellent opportunity to see the breadth of the industry. There are a lot of choices if you're going to look for a price sensitive patient base. That's there. And then also, I'd like to just add that while we're focusing quite a bit on technology, and increasingly so at Vision Expo and within the Vision Council, and so you'll see a lot of integration of really rapidly advancing autorefractors, the use of AI, things that can help practices see more people, maybe more efficiently and more cost effectively. I was just at the National Vision Partner meeting last week, and TopCon in particular is a name that comes to mind, with just incredible solutions to help practices see as many patients as possible and provide excellent care. So the emphasis on technology is it's very broad. It's new products and new entrants into the market, but it's also how we can continue to evolve how care is delivered, and then all the way down to software and technologies that can help practices run more efficiently. So I'd say technology is a huge focus of Vision Expo West, as well as supply chain.
All right, I want to come back to the tech in just a moment. You said something, and I wonder, Elise, I had heard somewhere that you have an unpublished or soon to be published study about about U.S. made eyewear, and I heard you say, Ashley, about tariffs, for imported product, and I wonder, is there any data? Do consumers prefer? Do consumers care? Do consumers even know if something is made in the U.S.? And if as a marketer, I think about it, and we've certainly taken every opportunity we have when a client of ours, when a practice says, "Hey, I have this new frame line, and they're all made in the U.S." We take the opportunity to communicate that to the patients, because we think people care. They kind of instinctively believe that people might care about that. And what we're also finding is that sometimes those lines aren't so much more expensive than things you can get overseas. In some cases they are, but in some cases maybe they're not. So how does that impact consumer sentiment? What do you know about that?
Yeah, so what we've seen from our recent study is that a little over half of consumers consider made in the US an important factor in their purchasing decisions. And about 47% report that that they buy American made products fairly often or always. However, sort of the flip side of that is that about 46% of respondents were willing to pay 6% or more, it's sort of a premium for products labeled made in the USA. So they're willing to spend more, but not a lot more. And so that's where things can get a little tricky. Part of what we wanted to do was sort of understand about like what people understood as made in the USA or what their definitions were, and sort of what they associated with those kind of products. So
So
about
what did you
20,
learn?
yeah,
Yeah.
so we heard that about 27% of consumers associate made in the USA products with supporting the local economy and sort of ensuring American job security, which I think probably resonates with most of us. We presented a few different scenarios to consumers to ask them about sort of what they considered something as made in the US, both from just a general kind of manufacturing experience, but then also eyewear specific. Um, and so one of the issues, and maybe you've encountered this in the products that you've worked with as well, some of the time it's really hard to source the raw materials for frames or lenses entirely within the US. And right now the FTC definition for made in the USA labeled products sort of requires all or virtually all materials need to come from the US. So it can be kind of tricky to label some products as made in the US, even though when all of the craftsmanship is happening in the US, if some of the raw materials are imported, they can't sort of under FTC regulations call that made in the USA. So that's something we're working on, sort of like Ashley mentioned, kind of our government and advocacy side is working on that. But the consumer survey that we did showed that 3/4 of respondents perceive frames made in sort of our fictional scenario as made in the USA when all the craftsmanship occurs in the US, but some of the raw materials are imported. So we're seeing that consumer sentiment is a little bit more generous to the definition of made in the US versus what the sort of very strict FTC regulations are.
Well, and you got clever marketers who might be able to say crafted with care or crafted with love in small town Alabama or whatever, and
That's right.
then that's the message the consumer hears, not the and the hinges were made in China or something.
Right.
So I get that 100%. But you're saying that consumers do care and they'll pay a little bit more, but not a lot more
That's
for
right.
U.S. based product. So again, that's another option for your sourcing options when you're going to something like Vision Expo and you're trying to decide, what am I going to put in my optical, and how am I going to potentially fill the frame board. Now, I do, and at least you may have no data on this, but I wonder, Italy is often associated with like the fashion capital, right? Like Italy, France, those tend to be associated with the fashion capital of the world. And I think that there are lots of people who believe that there is that there's when we're trying to position glasses as fashion accessories rather than medical devices, then Italian made or French made or something like that has an impact on consumer sentiment. Do you have any data on that? Or
That's a great question. I don't have any data on that, but now I'm interested in that as well. So maybe that's something we can do the next time we survey consumers about their frame preferences.
that's great. Okay,
Yeah,
fine.
I'd be interested.
I will. I'd love to hear the results of that when that comes out. So and again, back to you, Ashley. Are there a lot of are there a lot of manufacturers who have shifted to U.S. based manufacturing because of these tariffs?
Well, there's definitely been a migration of production out of China. they're, primarily into Vietnam and some what we call friend shore countries like Mexico. So that has been happening for the last 5 years. It was especially important during COVID when all supply chain was just completely disrupted. So the industry knows that it needs to diversify. What we're trying to communicate in Washington is that the industry could use a little bit of some partnership from the federal government to make this possible. So, a perfect example is, if you, that's fantastic if you want to manufacture in the United States. We have several companies who do it. Europa, State Optical in Chicago, they do it, but they're still sourcing products from around the world that are hit with really heavy tariffs. So what we're trying to communicate on Capitol Hill is like work with us. If we're employing people in the US, we can barely keep these factories staffed. Like we have the work is there to be done. And we're doing everything that we possibly can to be in the US, but we're still being punished for importing some raw materials. And it's a heavy fine. So that would certainly impact the cost. So that's our argument. Isn't just please let us out of this. Our argument is we're trying very hard. We're trying very hard to get out of China and diversify supply chain. So can you please make it just a tiny bit easier?
Yeah, right.
Give some relief, because more companies, they want to do it. It's just currently there's no incentive to do it.
Well, and you said earlier, I think it seems like the costs are being passed to the patient to some extent.
Of course they
I
are.
also, based off of the data that Elise presented kind of 10 minutes ago, is that it actually seems to me like maybe some of the cost is sticking with the OD, sticking with the practice owner, because I might be, if I'm worried about the fact that my patients aren't spending more, I might be reluctant to raise price. And I don't know if you have any data on, how many people have raised price and how much they've raised price and what the norm is to raise price at this point in the inflationary cycle. But I believe, kind of from a common sense standpoint, is that anytime someone tries to raise price, they have a reservation that says, well, I'm worried that, my patients are just going to, that's going to drive my exam onlys. It's going to lower my capture rate. And, or my patients are just going to downgrade into something that, is not as exciting for me to put them in, and it might not serve them as well. And so then you start saying, well, then if you're not raising price, but your costs have gone up, then who absorbs the cost? It's the OD. It's the practice owner. And that's, and they're already being squeezed because, how many times have the managed care plans raised reimbursements? Well, not many ever. So, I think we have this interesting dichotomy. So I don't know if you have any other data that could support that before we move on to another topic.
Well, I would just say, sort of generally, we've seen actually a little bit of deflation overall on the price of frames. And we
Really?
think that's really coming from the online sector. So it may not be that we're seeing deflation in practices, but just overall, because there are more sort of online frames offered at a really low price generally to the consumer, that we see that overall frames price dropping a little bit, sort of the average frames price. I think from 2022 to 2023 had a slight decline in it. And so that's where we're seeing sort of the competition that exists in the market, especially with the sort of very low cost online frames, that we're seeing a little bit of deflation overall in the market, but not necessarily at the practice level.
Yeah, what's interesting is when you think about online retailers, and I know we talked a little bit about this the last time you were on the show. I don't know if there's an update, but our data, so the way we track data, and are very different than yours, but it's really kind of fascinating to put the two and two pieces of the picture together, is that we look at demand data not by asking consumers, but by asking Google. How many times does somebody type something into Google? And when they type that thing into Google, then it gives us an idea of how frequently, what level of sentiment is there around a particular thing. So if I type in eye exam near me, that's a pretty high value demand component. If I type in, I don't know, pick a manufacturer, Ray-Ban glasses, that also gives you an idea of what demand for Ray-Ban looks like. And of course, you see that go up in the summer, you see it go down seasonally. Like that's really common to see things like that. But overall, when we look at keywords associated with online stuff, whether it's the names of specific manufacturers or just cheap glasses online or whatever that looks like, we've actually, at least in our research department, we've seen that go down over time
Hmm.
substantially
Yeah.
since about 2020. Like it peaked in 2020, obviously. I
Hmm.
don't really remember why. There's maybe some sort of event. I don't remember, but it peaked at that point, and then it started coming down. It was pretty high in 2021, and then ever since then, it just started coming down, coming down, coming down, coming down in terms of consumer demand for cheaper glasses online. Now, what I'm wondering, based off of the data you just shared, is if the competition between online retailers has more to do with the fact that they have in order to compete as an online retailer, you have to compete on price. You have to lower the price of the frames, and then the consumer that's left is the really truly discount, bargain basement consumer. It's not your typical consumer who's going to spend $400 at the eye doctor and is excited about spending $350 at the online place. No, that consumer's dropped out of the market. Now you've got the person who's really just looking for that $19 frame, and maybe that's what's happening. And then they've got price competition that's driving their customer acquisition model too.
Yeah. So lots of things to touch on there. I would say that we are also sort of seeing a general decline in our survey data. So we track consumer surveys each month in the US. So right now we have 4,000 consumer responses in the US each month, and then we roll them up into a quarterly report. And so what we're seeing in our quarterly data is that overall in 2023, we saw generally about 1 in 6 purchases of eyeglasses, prescription eyeglasses, were online. So that's still saying that 5 out of every 6 purchases are happening in person. So in person is still the driving force of the way that people are purchasing eyewear. But we are seeing some declines in 2024. So we saw it at about 14% as opposed to 16%. So we saw a 2 percentage point drop to Q1 of this year, and then one more percentage point drop in Q2 to 13%. So we are seeing some overall decline from that peak in 2020, or for us, we saw it probably in 2021 was the sort of peak of online eyewear purchases. But we thought we would see it stabilize because we'd seen it for about 2 years at that 16%, but we are seeing a decline this year into that 13, 14%. So that's something we're keeping a close eye on. And I do think that, but I will say, and we probably talked about this last time, is that there is not just an online, well, there is a small portion of people are just online eyewear buyers. Like my husband, who I can't get him to buy anything but
Come
like
on,
20,
Elise, you're in the
$25 frames.
industry.
I know, I've tried, let me tell you. But he just won't do it. So there's people like my husband who are stuck in the $25 frames because he really likes this one pair. And when he breaks them or they scratch or whatever, he can just buy another. So don't get me started. But we all are seeing about half. So I think in the most recent quarter, it was 43%. Oh, no, it was 53% of online purchasers. So they made their previous purchase online. About 53% made their most recent eyewear purchase in person. So there's
Mm,
not always just an online shopper or just an in-person shopper. People often go back and forth.
got it.
Namely, the online shoppers sort of people we're seeing mostly are buying those like backup pairs, things like that, or maybe a more fashion-forward piece, or maybe their prescription sunglasses they're buying online, but they're sort of going back and forth, we think, to use their managed vision care benefits in person, and then likely buying that sort of very budget frame online.
So it could be that we need to do better as an industry at communicating second pair sales, the value of a second pair sale, maybe communicating with patients in between visits about other options and potentially extending like a one-time second pair discount. As a marketer, I'm thinking all the
Yeah.
different solutions to that problem, if we're trying to retain patients with in-store purchases. Now, let
Yeah.
me ask you, are there any particular categories of eyewear that are more often bought online that you're tracking or have any studies coming out about?
I'd have to look at our data a little bit more, but when we've surveyed folks about sort of why they buy online versus in person, they're really price conscious, the online shoppers. So we're seeing that as a driving factor in their purchasing decisions, as well as convenience, like not having to go in person and, get fit for frames or whatever. Those are what people are saying is like factors for influencing their decision. I'd have to look back at the data, and I can get back to you, but I'm not sure if we're seeing a split between, sunglasses or clear lenses. I'm not sure what that looks like online, but we do see that generally, there's a little bit higher percentage of people buying single vision lenses online, as opposed to sort of the share that single vision lenses have in person. We're seeing a little bit higher of folks buying progressive or bifocal, trifocal lenses. They're more likely to buy in person than online.
Got it. So, are there any other, while we talk about consumer studies or anything else that's coming out, is there anything surprising or anything else that's kind of going to be hitting the market that you can give us a little bit of a preview on? And then I want to go back to Vision Expo.
Sure. So one of the reports that we have coming out shortly is about safety eyewear. So the use and the purchasing of safety eyewear, we've sort of split it into like sports eyewear, sports safety eyewear, and then protective eyewear that people use like on the job or sort of recreationally with at home or hobbies. So one of the surprising things that I saw that that it's actually a little bit more common to own or to use safety eyewear than I had anticipated. So
What percentage? What are you seeing?
yeah, so I think it's 1 in 4. So we're seeing about 27% of adults say that they've worn protective eyewear. Most commonly, they cite it when swimming, so like goggles when they're swimming. And then 1 in 3 adults, so 31%, say that they regularly wear protective eyewear, like safety glasses or goggles, while doing yard work or lawn mowing, working on home renovations, or at work. So those are a little bit higher than
I was
I
shocked
anticipated.
because there is this national rise in pickleball, and I thought that
Yes.
maybe this was a correlation. But okay, keep going.
We do ask about racket sports in the study, but they weren't at the top. We mostly saw it, um, I think, for people who are swimming or let me see if I can pull this up here, but we've seen it generally for, let's see, hiking, running, biking, and fishing were sort
Mhm.
of the top categories when people are wearing sports eyewear.
And,
Um,
and what percentage of that has a prescription?
So we're seeing about half of folks saying, both for sports and for protective eyewear, that about half are saying that they have a prescription in their lenses.
Hmm.
So, that was a little bit higher number than I expected too. And what's interesting is that we're only seeing a pretty small portion of folks saying that they're buying either their sports eyewear or their protective eyewear at an optical shop. So about 15% saying they're buying their sports eyewear at an optical store, and about 13% of those who are buying safety glasses saying that they get it at an optical shop, and 9% who are buying safety goggles. So I'm not sure exactly how that all evens out. We do see most people are saying that they buy safety eyewear from online retailers and big box stores. So it could be that they're buying their prescription lenses, perhaps online.
Fascinating. Yeah. I mean, I wonder how much of a safety selection people have. We have one client I can think of that's in a rural, basically like a blue collar community, and they have an extensive collection of safety eyewear, and they constantly want to feature it because they're ahead of it, thinking about it. But you're right, maybe the consumer is not thinking about the eye doctor as a place I can go get safety eyewear. And so, back to you, Ashley, are we doing anything about that at the show, and especially with the sports component?
We certainly are. We do think it's an enormous opportunity. The show has traditionally focused on fashion and healthcare. And what we're leaning into this year is lifestyle and technology, of course. But we think that having that lifestyle conversation when patients are in the chair presents an entirely new opportunity to improve recall, talk really about the functionality of eyewear, the different choices, and really get people thinking about how they want to protect themselves and perform better in their hobbies. So, National Sunglasses Day, which is one of our hallmark campaigns every year to raise consumer awareness about UV protection. This year, the Vision Council focused it on gear and performance and mountain biking and pickleball and lifestyle. And you'll see that pulled through on the show floor next week. We have a pickleball court and a sun and sport pavilion.
Wow.
And it is the first step in what we're going to be building out into more of a lifestyle play.
Okay, so do I have to wear safety eyewear when I go into the pickleball court?
Well, it depends on how that affects your game. Like if you want to win, people are really competitive in this industry. So whatever's going to make you a winner next week, do it. But yes, you should certainly be thinking about protecting your eyes, even beyond racket sports. You mentioned the practice in a rural community. Lenses make a difference when you're fishing. Lenses make a difference when you're doing anything on the water. You all know all of this, but it's just I think it's a huge growth opportunity for doctors to be talking about this, having this lifestyle conversation.
Yeah. Fascinating. And so it sounds like, talk more about how else you're shifting the show. You said you're going from medical and fashion to more lifestyle related things. So what else are you showcasing, and then maybe circle back a little bit to the technology point that you made earlier?
Sure. So at Vision Expo West, we will launch the Sun and Sport Pavilion, but it's the first step in what will be a completely new activation at Vision Expo East in
So
Florida.
this is the first time that the Sun and Sport
For
Pavilion
Sun and
will
Sport.
be. Okay, got it. Great.
Yep. Yes. So we're excited about it. It's a first step, but what we envision by next February at Vision Expo East is to start really embracing the over-the-counter sunglass and reader channel. We know that that's where patients may have their first experience with eyewear and vision correction and vision protection. And so we know it's a way to embrace an entire other community and get them coming into practices for regular eye exams. It's kind of part of the patient life cycle. And we think what that also helps us do is to start to evolve the show to just get closer and closer to what the patient wants, what the general consumer wants. We've long tried to get people to go in and get an annual eye exam for themselves and everyone in their family. We think this gives us just another angle to start talking to people about how eyewear and sun protection and readers are part of a healthy lifestyle and protecting your vision health and also helping you do better in your day-to-day. And then that should translate into a long-term relationship with an optometrist as vision needs change.
Well, and you're absolutely right. I think we all kind of inherently know that if somebody listens to us, and if somebody listens to us and makes us feel important, then the reality is that we're more likely to buy from them, and we're more likely to see them as a trusted advisor, and we're more likely to come back more often as well. And so I think, kind of starting or centering the show around something that's really important to people, which is their lifestyle, and then actually using making it seem a little bit more, I'd call it genuine rather than transactional, I think is the key inside of practices. Um, I think that really becomes a true opportunity for sure. So circling back to technology, you had mentioned that there's a focus on AI, and there's a focus, and even in the last 6 months, AI has truly, since the last show, AI has truly dominated so many conversations that I'm part of. And I've been asked to speak around AI on lots of different topics, most of the time, and how you get more patients or how you improve practice flow, practice efficiency. But there's lots of incredible technology and lots of smart people thinking and talking about this. So if you're going to the show, what do you really need to see in order to see how far we've come over the course of the last 6 to 12 months?
I think it'll come down to taking that time to meet with the exhibitors, because you won't just walk by and see in concept and talk about AI. You'll actually see it in practice and what it can do immediately and how it can exponentially help the practice serve their patients better and potentially identify questions that should be asked, be more clued into what the conversation should look like in the chair. But I think that's one of the things that makes Vision Expo incredible, is that it is there, it exists now. And in talking to exhibitors and talking to peers and talking to other practices, which you will have an opportunity to immerse yourself in at the show, it'll start to make a little bit more sense and be less and less intangible the more you see it and touch it and understand how it's already working for practices across the country.
Yeah, I mean, anything that's completely new that you definitely have to stop by and see if you're going to the show.
Well, I'm so thrilled to say there are always new independent designers coming onto the scene. So there will be, we will never abandon the cool factor and the fashion factor, and you'll see plenty of new collections and trends. Yeah. And that is also, of course, very, very important if you want to wow your patients when they're picking out their frames. So plenty of new exhibitors. SLO Exotica is placing a significant emphasis on technology integration that will go into practice management, as well as continuing to focus on the nuance frame and the opportunities to combine vision and hearing. It's not to be missed. It's a huge opportunity for everyone. And I think that will kind of set the tone between the presentations on our innovation stage, the type of product that certain companies are preparing to show and focus on, and then the actual in-booth experience that's showing how technology can evolve a practice. It's all there, and it's immersive and experiential. It's not like vagaries from someone like me who is still trying every day to learn more about AI. It's amazing to see what's already happening, and people will get to see it at the show.
Yeah, that's awesome. And, I think when you talk about hearing and in the vision space, I do think based off of the feedback that I got, we did a hearing episode a few weeks ago. And I do think that based off of the feedback that I've gotten from that episode is that the industry is kind of ripe for it. There's a lot
Absolutely.
of chatter, and people really responded well to the business models that I highlighted on those shows. And so, Elise, maybe another opportunity